A couple of things before we dive into the data dashboard and give the COVID update. There's many emails of appreciation for the work that public health is doing, and I always can't read them all, but I would like to read one of them. It says, it was a nice card. Thanks to all of the employees and volunteers for our wonderful J&J vaccination experience on Sunday, March 7th. Every part of our experience was truly wonderful, from the parking lot volunteer to the recovery personnel. We are so truly grateful for how efficient and kind the entire group of people involved were in getting so many people vaccinated. David and Martha Pitts. And this is a handwritten note, and we also received emails, but just wanted to stress that, with our small but mighty team and public health team, they know the flows and clinical safety practices and how to put those together. In addition, with our partners that with the vaccine consortium, Matthews Vu and the hospitals and working with the fire department. But I want you to know that we're receiving much feedback related to the appreciation. And then we also passed the 1-year anniversary for our COVID response. And we partnered with the Board of County Commissioners, the chair, Stan Vanderwerf, as well as Mayor Suthers, Council Member Strand, and we had a remembrance at the Pioneers Museum, and I just wanted to read what was provided in recognition of the efforts, and public health was referred to as unsung heroes, but then also Commissioner Vanderwerf took the opportunity to talk about the work that we do, because a lot of the work that we do is on prevention and it's not tangible, but we know that there have been many illnesses and severe illness and deaths that have been prevented due to public health efforts. So this is El Paso County Public Health, really appreciation for being my COVID hero, all staff during COVID-19 pandemic, and in recognition of the many sacrifices made and the courageous actions taken, we recognize you as a true hero to our community. And so this is something that was presented to us by Commissioner Stan Vanderwerf, and we'll put it up in the hall in the main area of public health, but wanted to acknowledge that because there's so much that goes on a daily basis. So thank you for allowing me to offer some more positivity around all that's been going on, because there's definitely been so many challenges and stressors, but there's been some also shining stars, as Commissioner Vanderwerf said, that there's many shining stars in the darkness. And with that, Stephen or Fadi, could you give us a data update, and then we'll go into some vaccine updates and take it from there.
Sure. Good morning, everyone. We'll be giving some high-level case updates as well as vaccine updates. Let me transition to sharing my screen.
Yes, very small, but yes. We see the colors.
We're squinting, Roddy.
Let's see. Is that better?
The green and the blue and the green really are the changes for the new dial that went into effect today.
It's important that you describe what is on the slide, please.
Sure. Yes, as Susan mentioned, the dial 3.0 went into effect today, in fact. For us right now, our current status, not much change. We're currently in level yellow, and the metrics thresholds did not change from going from level yellow to level blue. We still need to drive our incidence below 100 per 100,000, and our positivity cannot be greater than 5%. So per our current status, nothing changes for us. There was a slight change from going to from blue to green. Now, if incidence is below 35 per 100,000, now it is level green, where before it used to be level blue. I'll be transitioning to giving a brief update on our current status with some specifics. Right now, our incidence is about 149. It's been remarkably stable between 110 and 150 for about 2 months, a little bit more than 2 months now. It's in that lower spectrum of yellow, but it has not budged to go below 100 so that we can be eligible for blue. Our positivity has been rising recently. It's a little bit of a concern there. We did see 10 days of positivity that's less than 5%, which at that time made the positivity eligible for blue, but recently it has increased above 5%, and currently it's at 6.15%. So that's it for the cases update for today, but I did want to transition to a brief high-level update on vaccine activity. As you may have...
Bonnie, before you do that, let me just emphasize the dial, the 3.0. So yesterday evening, the State Health Department sent some information as well as a news release, putting everyone on notice that it goes into effect today. So some counties it will benefit them to being able to expand capacities or percentages of capacities. However, as Fadi said, that we are in the yellow and we continue to be above 100. And so El Paso County's 7-day incidence has to get below 100 in order for us to have any significant changes in the blue or the green, which would be increased capacity to 75% or even greater than that. The last time that we had we dipped below 100 7-day incidence was October 14th. Correct me if I'm wrong, Fadi, but that's what my memory states. So October 14th was the last time that we had that low incidence. So some of these changes on the 3.0 dial do not affect El Paso County. And so I did want to make mention of that since it's so new and we still need to look into the various different areas and have a better understanding. That we work with all of our business community, including the restaurants, to provide guidance on that. And as a refresher too, there was a stakeholder process with the state. They sent it out through, I believe, the media and had various different stakeholder meetings to gain input into the 3.0. But it's going to take local public health a little bit of time to dive into some of the details and then work with the different sectors on what that means. But globally, our numbers are not below 100 7-day incidents, and it has to be below 100, and therefore some of the 3.0 dials or changes are not going to affect some of our operations currently.
Susan, can I ask you a question? You're hearing a lot on the media about this spring break spike.
Mm-hmm.
When are you guys going to be really keying in on that? When are you expecting to see a spike?
So we continue to monitor, and that is on our radar, and I'll ask Fadi to give some more insight into that question. Fadi, did you hear?
Yep. Usually what we used in the past for Thanksgiving, Christmas, New Year's, or any major holiday is a 14-day period after the end of the last day of the holiday, so that we can see and observe if any spike occurs. One of the concerns about the spring break is travel. So we're hoping to see little to no effect because of an increased activity during spring break.
I have a question too. On the incidents per week, have you broken that down at all to age groups?
Yes, we do display and monitor demographics by age, sex, and we can look at most recently. For example, if we take a look at March 20th, March 14th, we can see if there are any patterns. Right now, we haven't really. Nothing has sort of gathered immediate attention, no red flags yet. We do know there might be a little bit of a change in hospitalizations, and we have seen less deaths over the most recent months. We're hoping that the increased activity in vaccinations, of course, is going to lead to a decreased pattern in hospitalizations and deaths.
And Fadi, we can't see the bars, and this is all on the public data dashboard, but could you just maybe verbalize?
Yes, I'm showing our 11th page of the case dashboard. On there, we display ages by decades, and you're free to select any time period you would like in order to investigate and compare age distribution of cases. We also allow folks to check off if a case has been hospitalized or deceased in order to see that play as well against the time period.
This is Yolanda. I just wanted to mention that Colorado College, they're not going on spring break. And I was wondering if you knew if UCCS and or Pikes Peak Community College was doing the same.
I don't have that information. Susan, would you?
Yeah, I'm not
know the
sure if that's
specifics?
anyone for our schools team, but we can get back to you with that specific. Anyone from our higher ed or our school teams on the call?
Speaking, I think it's a touchscreen. You might be able to just scroll it up a little bit to be able to.
We can't see what that big bar is.
I needed numbers per decade, not an explanation. I wanted some specific data.
Okay, so let's do it. Let's do it. Bonnie, if you can go back to the bar chart. Please.
Sure.
In the chat,
Okay. And scroll up just a little bit. Can you move it upwards just a little bit?
They want to know what the big bar is, the numbers on there.
Yeah.
The blue bar.
Sure. We need a breakdown per decade. Is that correct, everybody?
Yeah, I'm curious.
Breakdown per decade, if you have that, please.
Sure. I'm selecting March, if that's okay, unless we want a different time period.
March is good.
That's fine.
Okay. The most cases, we've had a total of detected cases of 3,037. The most were among the 20 to 29 with 774. And the 20 to 29 are the highest percentage of age group in terms of the entire population reference. They make up about 17% of our population, 17, 18%.
So we've seen a really dynamic switch in that age group of positive cases then.
What we can do is we can dig a little bit deeper into that in order to get the specifics and provide that to you by the end of the day, just to make sure that we're speaking accurately about the comparison between month to month, all time versus March, and age distribution.
Because it seems like that's the age group going back to school, going back to work, and are we seeing that increase?
And they're not being vaccinated yet.
Yeah.
Fadi, pull up just February as a comparison.
Okay.
And then Carolyn Gary, who is our part-time grant writer, also is a professor at UCCS, and they have a split spring break this year.
Yes, we'll be happy to dig deeper and analyze the age distribution of most recent times compared to all time or even just 2021, and can provide that to you.
So for February, I can see it a little bit. The same age group as the 2029, the big bar on there.
And we're not planning on vaccinating that age group probably before July, is that?
No, so in anticipation of what the governor has said, mid-April, it will be open up to the general public, which will be 16 years of age and older, because the Moderna vaccine is approved for 16-year-olds. And then I know that there's some testing going on, trials for 12 and up, but it should be mid-April, and there's going to be a progression if what we're being told is true around production, that there will be some increases in vaccine that we'll be able to provide more vaccinations.
Hey, Dr. Johnson, do you have a comment for us, please?
Yeah, I believe there is a study out of Israel, and Stephen and Fadi, you can help with the details of it, but it is showing significant decrease in the severity of disease and hospitalizations among those who are vaccinated. And because of their spread of vaccine in that full distribution, they're able to gather data in a pretty meaningful way. I was wondering if we could go back to December, though, because if you look at February, we see that while there is still the 20 to 29-year-old is dominant, we're seeing decreasing cases compared to March. And I think that we'll see those numbers of cases in the demographics of our older population begin to shift with the vaccine, which is actually really great data to indicate how effective our vaccine efforts are in suppressing not only the severity of disease, but that transmission. So anyway, you can see that there's a little broader curve to this, with the 20-29, again, dominant, but they're also the most active and out and less likely to perhaps wear a mask and keep their groups small. But we see a significant increase in the number of cases in that 60 to 90 year compared to what we have in March, after we've had months of vaccine effort into that demographic. So I think just a nice point. Thank you, Fadi.
So, Dr. Johnson, you make a really good point here in that comparing, say, December through against March, we've seen a decrease in the older age groups, which could reasonably be attributed to the vaccine. So I would think that this demonstrates that our efforts to vaccinate our population are working for those groups that have been eligible and received. Is that a fair assessment?
Yeah, I think that that's a good preliminary assessment, and it's, one that we can dive into deeper with Fadi and Stephen, because I'm sure Stephen will have caveats to the data, knowing this is all
okay, Stephen.
robust discussions we have. But I think that it's a really good first indicator that our vaccines are having the impact that we've anticipated, and that we look forward to as we see increasing distribution of those vaccines across population to achieve herd immunity.
No, you're right. And Dr. Johnson, Israel is a breathtaking experiment because of the scope and span of their vaccination campaign.
My concern is this group of 20 to 40. They're the ones that, if you look around, aren't wearing masks. They're the ones that are aggregating. And what are we going to, is there some way we're going to be able to connect with these people? Because so far I don't think we have. And if we don't connect with them, then I'm afraid they'll be very low on taking the vaccines, which probably is the same thing with influenza if we really looked at it. At least that would be my thought. And I have a real concern about that. I'm concerned about the younger people because I'm not sure that they're listening. Mm-hmm. Well, and every kid that's 20, almost all of them, as we know from our own past experience, they're immortal until they die. Yeah.
Well, we share the same concerns, and we're going to get into a little bit of information around vaccine hesitancy. We have been working with the Regional Recovery Council, which includes higher education, and also we have a schools team that works on a weekly basis with K through 12, but then also the higher education. And, now that, so it's been a challenge because there's been limited vaccine supplies and there's been priority groups. But as of March 19th, that has opened up and to restaurant workers. And so we know that there are younger restaurant workers, and they also, go to college. My daughter is one of them. She's 22, and she was able to get her first dose of vaccine as well. And we held a special pop-up clinic for restaurant workers that was walkable downtown yesterday. So we're working with so many different sectors and private partnerships as well as public partnerships to try to do all that we can to get in the people to be vaccinated, educate them, and then give them the opportunity. And I know that UCCS also was making some progress also because they can be an approved vaccination provider, so easy access to points of dispensing. And like Lance Bolton with Pikes Peak Community College, I mean, he's steadily taking our information and also to promote the vaccine campaign. And we're going to get a little bit more into the vaccine campaign, but we're steadily working to educate, inform, and increase access points for individuals that want to take the vaccine, because we want to blanket as much of our population as we can, and it's going to open up if if it's true that the production is going to increase and significantly March and then April. So with the mass vaccination site down at the World Arena, and we're also looking to open additional mass vaccination sites at the Chapel Hills Mall, but that's under discussion, but wanted to acknowledge that we share those concerns, and we are steadily working on vaccine promotion. Are you going to pick up the vaccine campaign?
I can give some high-level updates on the vaccine numbers, and then we can move on to the campaign if that's okay.
Sure.
Okay. I'm transitioning to our COVID vaccine dashboard. Just wanted to point out some exciting news. Okay, it is loaded now. We've currently, as of March 22nd, given out 224,000 doses. The exciting thing about that is about 35% happened during 22 days in March. And that really shows the explosion that is happening currently in the doses that are being dished out. We've increased our capacity, our supplies are increasing, and that's translating into not only more doses being given out, but more and more people being vaccinated and catching up on the second dose, meaning that they're fully vaccinated. Currently, we've vaccinated about 137,000 people. That is an underestimate. We do have the ability now on our dashboard, thanks to our partners, to show you that number in addition to federal estimates. So the 137,000 people vaccinated comes only through state data, but recently you were able to add federal estimates, and that number increases to almost 160,000. And that 160,000 people vaccinated is a cleaner picture of what's happening in El Paso County.
Did you say federal numbers? Is that for military and?
The VA, the VA, the DOD.
So our partners, they were agreeable to share information in aggregate, but it's our military and the VA, and to Fadi's point about our increasing vaccine supplies and kind of an explosion, I'd say we're probably at about 80,000 vaccines administered within the first, within March, whereas it took us from the beginning of mid-December to March to administer 14,000 doses because of the limited supplies. And so we can see that it's ramping up and opening up, which is encouraging.
Yep, right on the nose, 83,000 just in 22 days of March. And that's, if you recall, that's given the limitation of some weather constraints that led to cancellation of appointments. So really, really an amazing trend that we hope to continue increasing the doses. Okay, we'll be transitioning back into the PowerPoint slide deck.
Sure. What we wanted to do now is transition into discussing the vaccine campaign, just as we've already begun talking about. And we like to think about it from our analysis side as having 3 phases. And so far, our national focus really has been on the first phase, which is adequate supply of vaccine. The news on that front is quite good. Every day we monitor open source information to track this. And in fact, the supply is improving dramatically. The second challenge as a community is to actually have the capacity to deliver the vaccine, which again requires an enormous investment and a lot of different skill sets. And finally, and this is the one that we've begun to discuss earlier, is that we have to have sufficient demand and awareness and opportunity to vaccinate to give our population the chance to become vaccinated effectively. We can move on to the next slide. And again, the supply piece of the puzzle is largely out of our control. Fundamentally, it has to do with vaccines made available to the United States public. Right now, as everyone knows, we have 3 vaccines that are currently available under emergency use, 2 mRNA vaccines that were first approved, and more recently, a vector vaccine, Janssen or J&J, as people call it. The vaccine supply, we monitor these supplies, they are increasing pretty steadily. In fact, this week, the federal government will release, I believe, 27 million doses into the states. Last week, it was 22 million. So that's more than a 20% increase. So our point is that the supply piece is being solved. Also locally, as you know, there were some issues initially with the state of Colorado and fair vaccine allocation by population. It looks like they've made amazing strides in that regard, and thanks to everybody who's been involved in that. Those numbers have now narrowed, and the vaccines that we're receiving from the state have now become in alignment with our population, which is fantastic news. And Susan, if you want to pick up the discussion of starting to deal with capacity in El Paso County.
Sure. So in El Paso County and Colorado Springs, we have a vaccine consortium, which is a triple action plan of leveraging existing healthcare infrastructure. And then the second part of that plan is to expand large-scale clinics and mass vaccination sites, which we consider their capability to be vaccinating 1,000, providing 1,000 vaccinations per day. And then our third part of that triple action plan is to increase equitable access to vaccines by reducing barriers such as language and transportation and technology. So to give you a little bit of the scope of what that entails, and we have many credible and appreciated vaccine providers in town. And so part of our vaccine consortium are 23 active providers who they went through a process to be eligible to provide the COVID vaccine. And keep in mind that the storage and the handling of some of these vaccines also are ultra cold storage and the logistics of all what goes into that. We are incredibly grateful to all the providers. So 23 active providers, 98 locations throughout El Paso County and Colorado Springs. We want to make vaccine accessible and readily available depending on what the supplies are going to do. And Fadi or Stephen will talk about this probably a little bit later, but we're trying to create more visibility with providing a map on our site that people can, they'll know where they can go to get a vaccine. And we have all of this information on our website. So that's expanding all of the time, our access points, and it's all dependent on the vaccine supplies. We meet on a weekly basis. That includes 2 county commissioners, Stan Vanderwerf, as well as Lojinos Gonzalez, and sometimes Cami Bremer and Stan Vanderwerf change out. We also have Mayor Southers, as well as some members of his leadership team, Councilwoman Yolanda Vila, Dr. Tierbush, all of our vaccine providers, including Dr. Vu from Mathers Vu. I know that he's here today. Chief Colas has participated on that, but it's a vast group. Congressman Lamborn's office participates on it. So it's a vaccine policy group as well as a vaccine consortium with the goals of vaccinating as quickly, safely, and efficiently as possible in El Paso County. Our current population is about 522,000 that are eligible just based on the requirements of the vaccine, and soon it will hopefully expand. But we've got one of the largest populations in El Paso County, so we have to make sure that there's multiple ways that we're getting the vaccine out, and we cannot rely solely on mass vaccination sites because that's not, it's not preferred for everyone. And just to, say a little bit of a story, my 80-plus-year-old dad can't sit in a car for that long. I mean, access to bathrooms and wheelchairs, and it's so there's different modes to reduce barriers to provide vaccine to our entire population. So that is ramping up. It's steady. It's going well, and that is in large credit to our emergency preparedness public health staff for setting that up, and our immunization staff, our emergency structure, but also our healthcare providers and our pharmacies. They are engaged. They are making this a #1 priority also, and we couldn't do it without them. So that is the vaccine consortium that has a triple action plan, and we'll continue moving through that as we go along.
Susan? This past weekend, I was out at Calhan. Multiple people commented that they're hoping they'll bring the vaccine to them. Calhan, Peyton, the Eastern ranchers out there. Is there plans to do that? I know personnel is always, and transport of the vaccine is always difficult to logistically set up, but that was a request from multiple people.
And so we'll look into that. I do know that there is a Calhan clinic off the top of my head that is available, but those are areas too that we work together with our partners, and then if there is a need, then we will mobilize to bring those resources out. But one area that we are looking at is because we have the mass vaccination at the World Arena in the south part of town, but we know El Paso County is so vast, northeast, and so we're looking at different areas all the time.
Yeah, and they got the fairgrounds out there, so they got buildings and some other things. Our public health staff is scouted the fairgrounds. That we've also had a lot of businesses offer their sites up. Pikes Peak Community College up north, New Life Church, and what our folks do is they go do an assessment to see if it's a good flow, or whether it's indoors or outdoor. But those are areas that we will be fluid in and continue to look in and make sure that we're making the vaccine as easy and convenient for all, in El Paso County. And maybe you can just give me some points of contact also. Stephen?
Okay, and we'd like to move on now and discuss demand. Of course, demand is a multifaceted issue. As we discussed earlier, one of the big challenges is relevance. So there may be a wide swath of the community who sees no reason to become vaccinated. So when we say demand, it's a lot to think about. One thing that's really important is we want everybody's individual decision to be fully informed. And one of the big challenges is getting that information out. Information around vaccines can be confusing and controversial. And of course, it's been a long time now. We've been running through a pandemic now for more than a year. It's going to rely on a community effort. It's going to rely on multiple voices of influence. And we want to make sure that we increase access to vaccination, just as Susan has spoken about, for very many things. We've got to scale up the availability of vaccines, but not everybody's going to want to visit a mass vaccination site. So we want to make sure that vaccines are available through all channels that people are comfortable with. And again, we're having a discussion so that people understand that masking and vaccinating are our way out, and vaccines are really our way out of the pandemic. Let's go ahead and move to the next slide. The fundamental message, of course, is that vaccines are safe and effective. And this is a challenging message. Even more important, I think, is that vaccines, again, are relevant to our way out of the pandemic. The vaccines are proving quite safe. We've got a very rapidly increasing footprint worldwide and in the United States, one of the leading nations now in terms of vaccinations, that indicate that these vaccines are in fact safe. And we can go ahead and move to the next slide unless there are comments here. Again, fundamental message is we're going to get out of this thing by using masks and vaccines. So protect yourself, protect others by getting vaccinated. Our goal is to get our economy to recover, restore lives and livelihoods in El Paso County. So this vaccine campaign is going to be a long run. But again, as supply permits and as capacity is increasing, we need to vaccinate El Paso County.
Thank you, Stephen. And that's just, this is all on our website, but it's very easy to, well, I shouldn't say very easy.
Nothing easy about it.
We provided, how to register for vaccination on our website. There's electronically or to call 211 with Pikes Peak United Way or text vaccine or vacuna for Spanish to 6678732 to get connected. And vaccinations are continue to be by appointment only, so it's important to get registered. And Lisa, do we have you on the Teams call? And if you are there, thank you. If you could also key in when you're talking about the planning and highlights from equity clinics, maybe you can touch on UCCS as well as Pikes Peak Community College and how we're working with them to get, and CC to get their populations vaccinated.
Sure, yeah. So I don't know if there was any slides that I put up today or not, but I will first, I'll start with just first apologizing that I am coming off of 3 different points of dispensing in the last week of several thousand of vaccines that we've been able to provide to our community. And so it's really exciting that we're doing this this kind of work, but it's a little bit back to back. So I didn't have as much time to put together slides for you guys today. And I'm going to do more of a highlight of what we've been doing, mostly because I think that Fadi and Stephen do a fantastic job of talking to you guys about the numbers. So I wanted to bring more of this. Here's the human side of what we're doing. Again, knowing that getting vaccine into arms is what's important, but really wanted to share with you what we've actually been up to for the last little while. So we'll start with this picture of highlights from equity clinics. And I wanted to mention that with the state, they have an equity task force at the state health department, and they and individual organizations who are looking for vaccines specifically for a group that meets equitable trying to access vaccine has the ability to apply for vaccine clinics. And so in the month of March, we've had the Resource Exchange, the ARC, the New Jerusalem Baptist Church, the Payne Chapel for Africans Church, Hillside Community Center, Peak Vista, Meadows Park Community Center, and Mission Medical, all doing some kind of equity outreach and vaccinating somewhere between 100 to 200 individuals at each of those clinics, or will be by the end of this month. There's a couple coming up this next week. Additionally, we did have our equity clinic this past weekend, which was our second, it was the second Moderna vaccine for the Latinx population that we had partnered with Cervesio de la Raza to do outreach to this specific community of first-generation Hispanics in our community. And we were able to provide over 1,000 vaccines in that community. 929 of them were the return individuals who had come to the first clinic, and we did another 100, a little over 100 more individuals who were there for their first time vaccine. And while we were there, what you're seeing on the bottom picture there is Servicio de la Raza receiving a $5,000 donation from an individual family who was so impressed with the work that we were doing that they wanted to figure out a way to help Servicio continue to do the work in the Hispanic community here. So that was an exciting and interesting, fun thing that happened. And then
Lisa, before you go on, Councilwoman Avila, do you want to talk about the importance of trust? And then with Servicio de la Raza, what made that a successful partnership is working with the navigators or promotoros and kind of what that involves, because there's different areas that, you know, we need to key in on and implement in order to be successful. So
sure, Susan. Did I miss tamales? Were there tamales there?
oh, so
you missed the tamales.
Yes,
Oh my God,
goodness.
that was so awesome. Yeah,
And that is how Latinos roll. That's what I'm going to say.
for sure.
And when you talk about the promotoras, those are individuals that are boots on the ground in the community. They know the language, they know the culture, they know everything. And so under Julisa's direction, Julissa Soto, we've all been able to meet her. She's amazing and a crack up. But the promotoras to actually reach out, to call, and if they don't have a ride to, they were assisted in setting appointments, and they actually went out there to make sure that they had transportation and made it so engaging. And I'm so excited about that $5,000, but it came with a lot of work, a lot of community love and involvement, and it was just so great. And I'm so glad to see that. And I'm looking forward to seeing how we're doing in the equity stats, because I think with all the work that's been done with the different churches and community centers and with the promotoras and Servicios de la Raza, I think we should be looking good. So thank you all for all your amazing work.
Thank you, Yolanda.
I do want to mention when tamales are mentioned, so Servicio de la Raza, they took the initiative to make homemade tamales, homemade dessert, homemade, I think it's called champurranos, or some kind of drink from Mexico, as a kind of a bonding also with local public health staff and all of the partners there. And it was just a high energy, such welcoming integration also of public health staff. I know that there was some, I was a greeter, there was another greeter from the WIC clinic, and, bilingual, we had bilingual or Spanish language paperwork and English, and it just it was so fluid. People, you could see that they were so relieved non-verbally, and some people were cheering also, just to even be there. They were so relieved and appreciative to get their second dose. So it was great to see that in action.
Yeah, and I think that it was huge for us because this was the second dose clinic. So on the first dose clinic, the promotoras came in a little bit timid of working with public health, of integrating within our process, and this time around, it was much more welcoming between the public health department and the promotoras. By the end, like Susan said, second day, they were offering to bring food and brought in this wonderful food to share with us. And then at the end of the day, I went with Julissa's team to 3 margaritas, and we celebrated the work that was done. And our follow-up on this is that a few of the promotoras have reached out to ask if they can volunteer with us. They want to do some of the follow-up phone calls for people who didn't show up for that second vaccine. And then we took a waiting list as well. And as we begin to open up appointments Thursday and Friday and next week, we'll have the promotoras make some phone calls to get some of the people in who they hadn't been able to get in the past. Again, because of that trust issue, they are going to be able to, really talk about how engaging the public health department is, and how they can get people to our clinic without them feeling worried or concerned. So I think it was a huge success on so many fronts. backing up a little bit, we did also do the first Johnson & Johnson vaccine clinic on March 6th and 7th in our clinic. And that was a huge success. We did 1,500 vaccines in that 2-day time frame. And then quickly moved into March 16th, 17th, and 18th, where we partnered with King Soopers to host a clinic for frontline grocery workers. And the goal was to do 1,500. They were able to provide just under 1,000 of those vaccines during that time frame. And I'll also say that my team reached out yesterday to King Soopers, specifically to those pharmacists, to offer our support and condolences to the event that happened at their store the day before with the active shooter. And they appreciated so much our outreach in regards to that. We then I wanted to let you know that the World Arena did open on March 17th with a couple of bumps, but all of those have been worked out now. And that drive-through vaccine site is up and running really well right now. And the intent is to have that open 7 days a week here in the next week or so. And then yesterday, as Susan already mentioned, we did do in partnership with the Downtown Partnership of Colorado Springs and the Antlers Hotel, we were able to vaccinate just under 1,000 restaurant workers and people in the retail food industry with the Johnson & Johnson vaccine. And then today we're continuing to work on our Operation House Call, which is, again, the program where we are going out to homes where people are homebound, unable to leave their homes, and offering vaccine. That partnership is with Colorado Springs Fire Department and the Medical Reserve Corps.
Thank you, Lisa. I also wanted to mention that the state is trying to start a statewide program for vaccinating homebound individuals. And so our Operation House Call with the Colorado Springs Fire Department and the Medical Reserve Corps has been referred to as a model practice. So a model practice coming out of El Paso County that they are looking at very closly. And so I think that's always exciting when we're leading the way and can be helpful on how to approach work.
Yeah. And then, the Downtown Partnership restaurant vaccine clinic was so successful yesterday that the Antlers brought champagne in at the end of the night to offer to all of those who were sitting there waiting. It was quite cute while they were passing champagne around to everybody who was waiting for their 15 minutes at the end of their vaccine.
Makes me regret I've already got my shots.
That's how they do it, I guess, in the restaurant industry.
Champagne, tamales. I mean, this is good stuff. I'm just saying.
And we also partnered with the Pikes Peak chapter of the Colorado Restaurant Association. The president is Greg Howard. So, I mean, you can see the theme here. It's just like we can't get our work done without our partners, and they just have been fueling much of the outreach and the success. So thank you, Lisa. Let's move on to Dr. Johnson and update around the variant strains.
Yeah, so before I jump to the exciting variant world, I want to highlight the work that you just talked about, Susan, in that collaborative realm. And we have ongoing opportunities for that and are working on the education piece, bringing it full circle to what Stephen was talking around to promote the demand as well. So we had the opportunity to work with Colorado Springs Community Action Coalition and did a full panel with them going through the safety and efficacy. We've worked with Centura and one of their providers there to bring education into El Paso County Public Health. And Colorado Health Ethics Forum will be doing a panel on April 22nd around rural challenges. And I think that was that Vicki who brought up some of those rural challenges and really reaching out to understand and hear how we can continue to promote that. Michelle Hewitt's working with Telemundo and Peak Vista on some Spanish-speaking opportunities to really bring the language and message home. Pikes Peak Library District has a great outreach and are working with us. Kyle and I get to work with them directly, and the minority leaders meet every other week. And again, Kyle and I sit on that panel listening and hearing from them where they feel that we could really target those messages. And so I just want you to understand some of that cross-sector and outreach that we do, but also to invite you to bring other opportunities to us to get this message out robustly. So with that little plug, I'm going to jump right into the variant strains update. So next slide. So this is in the news a lot, and that brings up, there's variants that we see among viruses. We anticipate that because they are trying to assure that they have a life cycle that can stay robust. So they want to know that, not that they truly have consciousness, but they want to know that they can, transmit easily. And they want to find that little niche where they can, go ahead and thrive without really doing too much damage to their host, because they need that host to be able to transmit it on to the next one. And so as we follow these variants, there are the ones that are coming to the news are of concern, and they are of concern for us in the middle of this pandemic due to the fact that they may be able to spread more quickly. They have greater transmissibility, or they may begin causing more severe disease. And there's always concern that they would evade diagnostics or treatments or some of the immunity that we're able to obtain. And there are 4 at this time that are on our radar. They're referred to typically by their numbers, but we also, people will refer to them by their name of where they were first identified. So those are listed, the B117 that came out of the UK. It is of interest in Colorado because we are seeing it here, and we've had 38 cases in El Paso County. The B1351 is out of South Africa, and it, again, has been seen in Colorado, and 33 cases in El Paso. There's a P1 variant that is out of Japan and Brazil, and unfortunately we are not seeing that in Colorado at this time. And the B1427429, which is a variant that has emerged out of California. There have been cases in Colorado, 224, but we aren't seeing any of these in El Paso County at this time. So next slide. Oh, I'm sorry. Was there?
I think we had a question, Dr. Johnson, from Doris. Doris, did we totally drive past that?
Well, I had a question about, one is on the South African variant. There are 11 Colorado cases and 33 in El Paso County, so there must be something wrong with those numbers, correct?
Yeah,
that's a mistake.
Wrong with the numbers.
Yeah.
Pardon me?
Wow.
Stephen?
That is correct. That's a mistake. El Paso County shouldn't have 33 in that column.
Okay.
The 11 are only in the state of Colorado, all in one place.
And then I have a question on outreach. I know we've done a lot of outreach to our African American and Latino communities, but what about the Asian communities? I know it's a small community in our in El Paso County, but still it's significant, and was curious if we've done any outreach with that particular population.
Yes, they sit on the minority leaders group, and we do hear from them. I am not, other than that conversation and reaching through those leaders into the community. And Pikes Peak Library District, some of their efforts. I am not aware of other specific efforts. Lisa, are you?
I can speak to that a little bit, Dr. Johnson. So we formed a partnership with the El Pomar Emerging Leaders Program. And, you know, one of our close partners is Stella Hodgkins, who has been really spearheading this effort with minority leaders. And there are Asian members, which she is a leader and Asian herself within that group, but there's also Island Pacificers, Native American, and there's many different groups where they are helping us outreach. But I think the main effort that we're involved in is listening on how can we best support communities, and then doing outreach from there. But that's one of our main connections.
Okay, thank you.
And I have a correction. Thank goodness for Haley. The 33 in El Paso County is not actually South African. It's the U.S. California variant. That's the B147-429. Pardon me?
The California twins, that's right.
Yeah, so that 33 should actually be in the last column.
B127, right?
Yeah. So the concern about these is the way to actually impact our variants is to really suppress that transmission, so they don't have the opportunity to sit in hosts and create a pool for their own mutation. And so while we are monitoring those and looking at the implications, the most important thing that we can do is truly to just stay the course. We need to continue wearing our masks and get vaccinated, because the more that we suppress the actual transmission and infection rate, the more we will also suppress any opportunity for the virus to mutate into forms that create more challenges for us. So I'm complete at this time with that presentation, but want to open it up to questions if there are any, because it is, there just is so much in the news about this.
Questions for Dr. Johnson? I have a question, and my understanding is that first it was a limited supply, second it was some logistical challenges and sufficient healthcare workforce to administer and locations and so on. But the third hurdle that perhaps we're anticipating is enough people who want to continue to participate and get the vaccine. It's the demand issue. Can we, I know this is a well-trod path, but is there some way that it would be possible to incentivize getting the, I mean, it's obvious that you protect yourself and you protect others. I wonder, for some people, if that's not enough. Is there any way to, other than tamales and champagne, how can we incentivize people getting the vaccine? I think that's a hard one.
That I think is a hard one, and it comes back to a lot of discussion, Dr. Turbush, around resource allocation and bandwidth and ethics. We have utilized some incentives in the past, and so we know when we were doing our hepatitis A outreach, did some research and incentivized a lot of our partners. One, our homeless neighbors really responded to certain individuals positively. So we brought in Velda, who had a great relationship with them because they would accept a vaccine from her more readily. But we also incentivized with socks. So for a pair of socks, they were really willing to get a vaccine. So those are some interesting things that, you know, we do discuss. I think that when we look at some of the incentives, they aren't always in, you know, monetary or even, you know, one of the things in our 20 to 29, I think Dr. Bucks raised that question. You know, you stop and think, what is their value proposition? And so how do we message this in a way? Is it that it's somewhat edgy and you're a little bit more of a, you know, disruptor if you go ahead and get your vaccine? Maybe that's a message that we could put out there. And so really listening to those populations and hearing from them where they think that we can help to incentivize either with message or relationships or, you know, in some cases a pair of socks or something else. But that's a really good question. Thank you.
Well, thank you.
Can I piggyback onto that just a little bit? That's kind of what I was talking about with the Eastern El Paso County. You've got, El Paso County is very unique in how we have these subsets of populations and different beliefs. And you've got that farming and ranching community that we have not really touched with anything in the past. And I know I'm leaving, but if somebody could explore making connections with them, although they're not an ethnic group, they are a very powerful, like-minded group that hits thousands and thousands of people. And I think it would behoove the health department to look into trying to connect with them.
And part of that triple action plan is, you know, increasing equity and reducing barriers. So reducing barriers is not only aimed or to be helpful to minority populations, but there's so many different aspects of reducing barriers. And whether it's, you know, providing the education and you know, forms and formats and through different trusted people, or providing access to vaccine geographically, or, you know, however we can reduce those barriers, that's what we're interested in doing. And however we can incentivize getting the vaccine that is, you know, non-monetary.
Right.
I think that's really important, and that goes to strategy with the vaccine consortium and different trusted partners and groups, and you know, different strokes for different folks. In one way, with one size fits all doesn't work with so many is so much diversity in El Paso County communities.
And for that particular group, I was talking about the farmers and ranchers, it's trust.
Mm-hmm.
There's a lot of fear. We talked about that, about vaccines and the government mandating something. And, you know, I just think that working on that trust sooner rather than later would be a very good thing.
Mm-hmm. Yep.
All good thoughts. Anything else? No?
I don't have anything else other
Thank you.
than thank you, Vicki and Dr.
Yeah.
Bucks, and we'll miss you.
Yes.